We are really nice to meet you.
And I'm Vali Baiki, Assistant Professor of Epidemiology and Faculty Member of School of Public and Department of Epidemiology, and also Faculty Member of CNO Trauma and Surgery Research Center. Okay, first of all, let me who is present. I told you something about epidemiology, like types of study and measure of occurrence, like prevalence and incidence, and measure of association, like odds ratio and risk ratio.
Exactly.
Right?
Exactly.
And,
Cohort study, etc. Cohort study.
Yes, cohort, case control, cross-sectional analysis.
Exactly.
Okay. Today and this time tomorrow, I'm gonna tell you about two important topics in epidemiology. Today I'm gonna talk about systematic review and methodology, and it's an introduction because it's very hard or complex to want to explain in detail. But I'm gonna talk about an introduction about systematic review and meta-analysis. And tomorrow I'm gonna talk about errors in epidemiology, one of the most important and one of the hardest topic in epidemiology. Error, bias, systematic error channel. Error, yes. Okay, who is volunteer to explain briefly about previous session, like cohort, case control, cross-sectional, etc.? Who is volunteer? Could you remember anything about the previous session?
Sir, cohort study is non-random. It is
Cohort
non-random,
is not,
yes.
not random.
And
Okay.
case study is random. Case study is random.
Case control?
The case control
Is not random?
it is random.
No.
Cohort is
randomized control trial is random.
yeah, it is random,
Yes.
but cohort is not random.
Sometimes it's random and sometimes it's not random, because you should differentiate between randomization and random sampling. We have random sampling in all study, but we have randomization just in randomized control trial. Yes. Who is volunteer? For example, talk about tell us about, for example, difference between cross-sectional and cohort, or case control and cohort. Could you remember anything? We decided to we decided about your exam, and it will be a multiple choice, but please read many times these topics, because it's very important, and I think it's so hard. So please study these topics, like cohort, case control, cross-sectional, measure of occurrence, measure of association. It's very important. Okay. Today I'm gonna talk about systematic review and meta-analysis. Please listen to me and write your question, and I'll give you a time for your question. Please ask me your question in time. Okay. There are many references for systematic review and meta-analysis, and I mentioned systematic review and meta-analysis, and in this slide I mentioned some of them, and but they are for learning more, because in this session I'm gonna introduce you to an introduction, but these references are for more learning, if you want. Okay. There are many types of classification for study design, and for example, some researcher or people classify studies into observational and interventional studies, or some of them classify the study into descriptive and analytical. Yes?
Yes, sir.
And here I will introduce another classification for a study, and it's primary study and secondary study. What is primary study and secondary study? What is the difference between primary study and secondary study? Who knows?
I think so. Primary studies related to the basics.
Basics?
Basics. Then if you go ahead, the basis you will study in the secondary.
Okay. In primary study like cross-sectional, case control, cohort, and clinical trial. In primary study, we deal with individual data. For example, when you conduct a primary study, you are collecting data by doing your own surveys or observation. For example, I want to estimate the prevalence of depression in Kish. So in primary study approach, I should select a random sample from Kish Island. After that, I should measure the prevalence of depression. For example, I should use a standard questionnaire for measuring depression in Kish. Yes, it's primary study. So in primary study, when we conduct primary study, we are collecting data by doing your own survey or observation. For example, imagine that a researcher wants to determine the prevalence of visual impairment in Tehran, for example. In this scenario, or based on primary study approach, he or she, for example, selected more than 5,000 people and examined them for visual impairment. It's primary study because you deal with individual data. Yes?
1 minute.
But in secondary study, you don't deal with individual data. And secondary study, it's
Community level.
a survey of published previous study. For example, I want to estimate the prevalence of refract error or visual impairment in Tehran based on secondary study approach. In this scenario, I should search all international databases like Medline, Scopus, Web of Science, and after that, I should extract all articles on or about prevalence of refractive error in Iran. So, the most important difference between primary and secondary study is, in primary study, you deal with individual data, but in secondary study, you deal with secondary data or previous study. Okay? Most important secondary study, or main secondary study are narrative review and systematic review. And you can see some another types of secondary study like guideline and economic analysis, but I'm not going to about this study because they are out of our scope. So in secondary study, we deal with published or unpublished previous study. For example, articles like that and thesis. For example, when you want to finish your course or your grade, you have to do a thesis or Poyan Name in Persian. Yes. It's a study, and we can use them as data in secondary study approaches. Okay. I'll tell you about the difference between these two kinds of study later, but right now I have a question. Why review articles are important? Why review articles are important?
Sir, definitely because we have collected the data from the randomized people, there can be errors. So to go through the research of the article, that will lead us to the perfection of, and that will cover up the loopholes which are there in the overall research of the.
You mean it's hard to do a primary study?
I guess, yeah.
Yes.
But if there will be any healthcare unit or something, there we can collect data, that will be more
Yeah.
perfect, and we
Yes.
will.
And you?
So if we are considering a disease, or we are like focused on some disease, somehow it gives a like the past history of that disease, how it's spread before, like in that way it gives a past history.
Another volunteer?
Review articles contain information of different articles. Like the research articles will have on the same topic,
Yes.
but research articles have deep information about a certain thing. But review article has the information about the whole topic and it's more concise.
Yes, exactly. What is the one of the most important reason for doing a review article is that we faced information explosion over time. Do you agree?
Yes.
For example, annually thousands of journals and books are published. Yes? Or annually the number of literature relevant to medical field, for example, or medical field or epidemiology or public health is growing over time. Yes? So, as a general practitioner, or a general physician, yes.
Sir, I had a question about the secondary studies. You told the primary studies are like the data collecting individually.
Yes.
We take it. Is it from a healthcare unit, or we take it from the different individuals on the research basis level, on a different?
No. The differences between secondary and primary is that in primary you have to collect data from individual, but in secondary approach you have to collect data from previous study.
So does that mean secondary refers to the research of what we have collected?
Yes. For a general physician to keep update,
We need this.
yes, he or she have to read 90 new articles per day which appear in medical journals. And if reading in a study takes, for example, 2 hours, he or she have to spend 38 hours per day. It's impossible. Yes? Here, review article can be helpful because it summarize all information about a specific topic into an article. Okay? So, amount of information is rising over time, and time to meet information needs decreasing. And it can create a considerable gap knowledge. Okay, but review in this moment, review article help us because they usually will draw a conclusion based on previous studies, previous evidence. Okay, so review articles are very, very important. And this cartoon shows the information explosion over time. For example, most of people don't enough time to study the article, and review article summarize all study into a single article. I prepared some file for you, and please answer some question at the end of class and send me through WhatsApp or email, because I want to send a feedback and some, for example, final question test is based on this document. Yes, it's sample. It's not a final question. It's a sample for final quiz. Okay. Please can create, for example, WhatsApp or. Thank you. Okay. Do you have any question?
Making WhatsApp.
No, after class, please. Another reason for importance of review article is that sometimes you face clinical question that there is no consensus about, or in other words, there is a controversy about a clinical question, and here review can be helpful because review article try to draw a conclusion based on previous evidence. For example, sometimes you might be standing in a drugstore and wondering if are antioxidant supplements effective for preventing mortality in healthy participants. It's a very question, and there are many information about this question, and there is no consensus about this question. In this moment, conducting a review article can be very helpful because it summarizes evidence about this question, and you can trust on its answers. Yes?
Yes, sir.
Okay. Okay, so far I talked about primary and secondary study, and I told you some differences between primary study and secondary study. After that, I told you something about the importance of review articles, and right now I'm gonna talk about the differences between narrative review and systematic review. What is differences between narrative review and systematic review? Please divide it into 2, 4, 6 review or systematic review. In systematic review, we focus on a specific question, and in systematic review, usually we use explicit, pre-planned scientific method to identify, select, appraise, and summarize similar but separated studies. It means in systematic review, we should do all steps systematically. Okay, and there are 4 steps that differentiate between systematic review and narrative review, which is systematically identify, systematically select, systematically appraise and systematically summarize all result of a study. For example, in systematic review, you have to identify all evidence on the topic. In systematic review, you have to identify all evidence on the topic. But in narrative review, usually researchers tend to select articles that confirm his or her hypothesis. Okay?
No, sir.
In systematic review, for example, the question is that what is the prevalence of depression in Tehran? In systematic approach, you have to identify all evidence about the prevalence of depression in Tehran or in Iran. But in narrative review, you select articles that confirm his or her hypothesis. For example, you believe that smoking increase the chance of or the risk of cardiovascular disease. Okay, it's your hypothesis. Smoking increases the chance or the risk of, for example, cancer or cardiovascular disease. In review art, in narrative review, you select usually the researcher select articles that confirm his or her hypothesis. For example, if a researcher believes that smoking increases the chance, he or she try to collect evidence in which
In order to prove his
which smoking it's a risk factor for cancer.
cancer.
But in systematic, you should and you have to search and identify all evidence. It doesn't matter it's what is your result or its result. All evidence. Okay?
So that means actually narrative review refers to the theoretical form of the research, whereas the systemic refers to the practical form.
Yes.
In the field we collect the
Yes, yes. For example, usually narrative review are written by an expert,
Got it, sir.
but systematic review are written by everyone
Research.
because it's systematically.
Analysis research.
It's systematically. It doesn't matter who do a systematic review.
Got it.
It's systematic, so it doesn't matter who conduct a systematic review. Okay. This figure tells us an important things about the review and reviews, and that is not all reviews are systematic. Not all reviews are systematic. But
Yes,
a
sir.
subset of all reviews are systematic. Okay? Okay?
Okay, sir. Yes, sir. Got it, sir.
Traditional or narrative review usually written by or produced by a content expert. For example, a narrative review in field of neurosurgery or general surgery usually are produced or are written by a neurosurgeon or by a surgeon. But a systematic review in field of neurosurgery could write by everyone. For example, I'm an epidemiologist, but I have some systematic review in field of osteoporosis, like mental health or neurosurgery and etc. But traditional review or narrative review should written by an expert. Okay. And another differences between narrative review and systematic review is that in systematic review, we usually have a quantitative analysis at the end. For example, and I called it meta-analysis. Have you ever heard meta-analysis?
Just meta.
Have you ever heard?
Just heard.
Meta. Not that.
Mass analysis. you mean.
Okay. Quantitative analysis sometimes is one of the most component or one of the most important steps in systematic review, but in narrative review, quantitative synthesis rarely used to integrate or merge the information from multiple studies. Okay.
Quantitative
What
review.
is quantitative synthesis? What is quantitative synthesis?
I'll give you
Sorry.
some information about quantitative analysis at the end of this session.
Meta-analysis, yeah.
It means
Quantitative.
in the systematic review or yes, in the systematic review, finally we pulled all results from different studies. For example, one study shows the prevalence of depression in Tehran is, for example, 20%. Another one shows the prevalence of depression is, for example, 30%, and also, yes. In meta-analysis, you calculate a mean, but this mean is a weighted mean. Yes.
Summarize. We have to
Yes. Yes. Summarize.
Sir, narrative analysis is not covering all the facts.
I don't understand.
So, narrative.
I need to learn. You are from India,
Yes.
Pakistan.
Pakistan. I need to learn your
Sir,
language.
sir,
Please write your question.
Sir, narrative review is it is not covering all the facts.
In narrative review, you usually don't deal with quantitative measures. For example, number, value, for example, prevalence, incidence, odds ratio, risk ratio. But in systematic review, you usually deal with numbers. For example, finally we draw a conclusion about the prevalence of depression in Tehran, and it's, for example, 25%. Okay.
sir, actually he's saying is a narrative review not enough, that we need systematic review.
That's enough for?
Is that not enough, that we need systematic review?
Yes. Yes.
You're saying which one is most useful, right?
Systematic is more useful. At the
Exactly, and also
In
accurate.
the following, I'll give you some explanation about the importance of systematic review. It's very, very important. It gives us the strongest evidence in medical field. Systematic review and medical and meta-analysis give us the most important or strongest evidence in medical field.
But sir, we can't have the systemic review until and unless we
We
don't
cannot.
have the systemic review until and unless we don't study primary and secondary of
Yes.
the case.
Yes.
So that means for systemic review we need primary and secondary studies.
No. Sometimes the result of a systematic review show we should do a new study in error.
So that is what is the result of the systemic review. But I mean, systemic review needs primary and secondary studies.
Yes, primary.
Primary.
Yes.
Second,
What second?
secondary studies. Secondary studies.
Or randomized control trial. Randomized control. I show this hierarchy in
Thank
the
you.
following.
So you told about the systemic and narrative reviews. You told the systemic review can be performed by every person, like you mean.
Yes.
But
Narrative
but
review.
the most useful is systemic. But how we can rely on the systemic review, while the narrative reviews
Because it's
done by the
systematic.
expertise.
because it's systematically because there is a considerable bias. It's an important error in epidemiology, and tomorrow I'm gonna talk about this issue. But as I said before, in narrative review, researchers tend to select articles that confirm his or her hypothesis. And it's one of the most reasons to cannot rely on narrative.
Publication bias.
No, publication bias. It's another bias in systematic review. It's a selection bias.
Sir,
It's a selection bias
it
because
means, sir, it means that narrative review is just the opinion of an expert.
yes, exactly. It's focused on opinion of an expert, but systematic review it's a comprehensive view about a specific question.
So what are the different examples of systematic review and narrative review?
I'll give you in the following some example. Yes. This article or systematic review. Please look at this topic.
हमें भी एक दे दो यार
Yes, please
बस
look at this.
रज़ा मुझे गरीब बोल दो
ये ज़्यादा है इसमें आप ही
नहीं यार हमें वो दे दो यार मुझे वो चाहिए वो अच्छा है यार रज़ा ये गलत है हमें वो चाहिए
Narrative review are not in our scope, but I speak about and I talked about narrative review because it's important to know what is the difference between systematic review and narrative review. Because don't bother yourself about the narrative review. It doesn't matter, for example, in your final exam. Systematic review is very important for you, and the following I'll focus on.
For example, we are going to study that genetical disease.
Yes, for
Then
example.
that will become the narrative will be not in the systematic because it's theoretical. It cannot be a practical one.
Please repeat your question.
I'm saying for example, we are going to study genetical disease. For example, some other diseases that are related to
Yes.
genetics.
ये सवाल
We
पाकिस्तानी
cannot do
के दिमाग में
practical
सब
for it. We need to read theoretical. So it will become a narrative or systematic.
It depends on, for example, your question. Sometimes you are an expert and you make a decision to write, for example, a summary about a specific.
For example, hemophilia or color blindness, they are means you can say they are genetical disease. We cannot perform practical for them.
Mhm.
So my question is that is it will be a narrative or a systematic?
It's systematic.
Systematic.
Yes.
But in the systematic research, we need to perform practical. No?
Yes. In this paper, I give you two similar topics. Another differences between narrative review and systematic review is that in systematic review, one of the most important steps in conducting systematic review is critical appraisal. And you have to critically appraise all evidence, but in narrative review, it's not mandatory or it's not, yes, it's not mandatory. Okay. Okay, finally, differences between traditional and systematic reviews in terms of methodology and
Traditional narrative?
Traditional or narrative? Traditional is a synonym of narration. I cannot mark you as present in class. Okay, it doesn't matter. because you should, your final exam is based on your activity in class and your class attendance. This is done for. Okay, differences between traditional and narrative and systematic review in terms of methodology and research strategy is that in systematic review, you should search many databases. Databases like Medline, Embase, Scopus, and etc. And what in narrative review is typically less structured and systematic, and it's rely on experts, for example, expertise. And we don't have any comprehensive strategy for search in narrative review, and it's based on, for example, authors or expert opinion and expert prefer. But and another differences between systematic review and narrative review is that quality assessment of article in systematic review is mandatory, but quality assessment is not part of a narrative review. And in terms of objectivity and repeatability, systematic review is completely repeatable. It doesn't matter who do a systematic review. It's completely reliable or repeatable. But narrative review is not repeatable because it depends on the, for example, expert's opinion or expert, for example, idea about this topic. Okay?
Yes, sir. Got it. Clear.
And this table summarizes the differences between traditional narrative review and systematic review. And I'll give you a question in final quiz in this from this table. Yes, it's a final question. What is the difference between narrative review and systematic?
MCQs, right?
I'm telling you final question.
Thank you, sir.
Thank you, sir. Thank you, sir.
And I think it would be better to create, for example, WhatsApp or Telegram group. I think it would be better to create a Telegram group because it's very easy to send and receive a file.
Okay, sir. Okay.
And please ask me any question or contact me. Don't hesitate to contact me if you have any question.
Thank you, sir. Means a lot. Thank you.
Yes, and I'll send you some example question, and you can use
Sir,
if you have it clear.
final question will be MCQs based, yeah, we have to write theoretical.
Multiple choice. Yes, it's multiple choice. I think it's multiple choice with 30 to 30 question. I think 30 to 30.
Last time sir said that we have 30 questions from each slide, from two questions from each slide. Total 15.
Two question from each session.
Yeah,
Each session.
each
not-
session.
Yes.
दो
Yes. Okay. What is meta-analysis? So far, I told you the difference between. I told you difference between primary study and secondary study. After that, I told you the importance of review article. After that, I compared narrative review and systematic review. And right now, I'm gonna tell you about meta-analysis. What is meta-analysis?
Qualitative analysis.
Sir, it's the
Yes, it's a quantitative synthesis or quantitative analysis at the end of a systematic.
Sir, it's the conclusive step of the systemic review which leads to the quantitative
Yes.
research of the
Yes.
subject.
Meta-analysis is the statistical procedure for combining or merging data from multiple studies to yield an overall statistic. And not all reviews are systematic? Do you remember?
Yes.
And
Subset.
yeah, a subset of reviews are systematic. In meta-analysis, not all
All systematic.
systematic review have a meta-analysis section, but a subset of systematic review
Is meta.
have a
Meta-analysis.
has a meta. Because sometimes you don't have enough information for combining.
Got it.
Sometimes you don't have enough, for example, value or number for combining, and sometimes you don't have enough study for combining. For example, I want to estimate the association between alcohol consumption and osteoporosis. After searching, I find out there are 2 articles in the world about alcohol and osteoporosis. In this situation, I cannot, for example, I cannot have a meta-analysis because I don't have enough information for meta-analysis. Some evidence tell it would be better you have more than 3 study for doing a meta-analysis. If you have more than 3 articles, you can do a meta-analysis. Some evidence, it's not a rule. Okay. In the following, I want to speak about systematic review and the steps of systematic review. Please don't forget narrative review and etc. Please focus on systematic review. Okay. What is this? And Dr. Ostovar and Dr. Feinfeld told
Yes.
you about this hierarchy.
Yeah.
Yes. What is pyramid? What is this pyramid?
It was about subclinical and clinical.
This pyramid shows the level of evidence.
Yeah.
The level of
Evidence.
And the quality of study as well.
Yes. The quality of a study or the quality of result of a study. Okay.
Exactly.
As you see, this pyramid shows weaker study.
In the
Yes,
what-
low quality study at the bottom,
At the bottom, yeah.
followed by case control, cohort, and RCT, and at the very top, of
Severe.
this pyramid, systematic review
Indicates
is
severe.
systematic review and meta-analysis. It means the top of the pyramid represent the strongest evidence. Yes. Okay. In this slide, I'm gonna summarize all important topic about systematic review. In systematic review, we have to collect all possible study related to a given topic. After that, we should, for example, appraise the quality of this study, and it's one of the most important or one of the most steps in conducting a systematic review, quality of a study. After that, it's very, very important sentence. Please read these sentences because it's very important for final exam. Following a systematic review, if it's not possible to form a pooled estimate, it can be published as it without progressing to the meta-analysis. It means not all systematic reviews have meta-analysis. Okay, but sometimes if it's possible to form a pooled estimate, it means combining results. Yes, pooled estimate from extracted data, a meta-analysis can be attempted. Pooled estimate, for example, you want to estimate you want to assess the relation or the association between smoking and breast cancer, or past history or family history and breast cancer. Okay.
Lungs cancer, breast cancer.
Breast cancer and family history. For example, family history, and there is a person in his family that have for example, breast cancer in the pregnancy. Okay. For example, you want to estimate the association between smoking and breast cancer. Okay.
Smoking and lungs cancer.
And breast cancer. Okay. Medical family history is one of the most risk factor of breast cancer. For example, you want to estimate the association between smoking and breast cancer. Okay? In systematic review and meta-analysis approach, first of all, you should search all databases for a study that, for example, assess the relationship, the association between smoking and breast cancer. After that, you should assess the quality of a study. And finally, if it's possible to combine this effect measure like odds ratio and relativism. Do you know?
Yeah.
Yes, sir.
Okay. In this situation, you can report a pooled estimate. It means you should combine all
Values.
odds ratio, relativism, and after that you can report an pooled estimate. Okay.
Sir, if a member of family is suffering from a disease, then how much chance that the other member can affect from same disease? Sir? Like you said that family study is important.
Yes.
So what are the ratio or chances of effect?
Please repeat your question.
Like for example, in a family, one is suffering from a cancer.
Yes.
So you said that it may have chance that other
Yes.
can. So
Yes.
what is the ratio and the chances?
Odds, sir.
Chance.
What is odds ratio?
Odds.
Yes. It depends on your design. For
Yes.
example, some evidences based on cohort study show, for example, the risk of or the chance of breast cancer in individual with a member that had breast cancer is 3 times in comparison to a person without family history. It depends on your study or study design. For example, cohort, case control, and etc. Okay.
Mission route tekrar kunun lütfen. Previous slide. Previous slide. Last points, please. Hadi lütfen.
How many students can speak Persian, Farsi?
فقط توصيف سر.
فقط توصيف سر.
نعم
فقط توصيف.
A systematic review and meta-analysis will proceed based on or according to this flowchart. In first step, we have to formulate the research question. After that, we should search all databases, and after that, I should select relevant study, because after searching, you face many articles that it's not related to your question, and you have to exclude them. Yes. After that, you should extract data from a study. For example, when you want to estimate the prevalence of depression, in third steps, you should and you have to extract data about the prevalence of, for example, your outcome, depression, diabetes, and etc. After that, you should appraise the quality of study, and finally, if it's possible, you should have the meta-analysis. Okay. It's Another question for final exam. The most approach or most common approach for formulating a research question is PICO. What does it mean? What does it mean, PICO? P means population, I means intervention or exposure, C comparison, and O outcome. For example, in this example, in this article, the researcher assessed the association of alcohol consumption with selected cardiovascular disease outcome, systematic review and meta-analysis. Okay? Here, PICO is P population. P population. C comparison. I intervention or exposure, and O outcome. For example, O in this article is cardiovascular outcome. What is exposure in this article? Of impersion, it's alcohol consumption. What is population? Please write this. Please write this question. And answer based on this article. Please write this question. For formulating a research question is to use PICO. PICO means population, intervention or exposure. When we have a randomized control trial, I means intervention, and when we have observational study like cross case control or cohort, I means exposure. Yes. C comparison. For example, I want to compare two treatment or two drug for treatment of high blood pressure. Treatment A and treatment B, or drug A and drug B. Yes. In this situation, drug A, for example, it's exposure or intervention, and drug B is comparison. But sometimes there may not be a specific comparison group, and this situation, the C may be empty. For example, when you want to estimate the prevalence of a study, exposure doesn't mean, yes, you don't have exposure because you want to estimate prevalence of a disease, not prevalence of exposure. Yes, or a relationship between exposure and outcome. Okay. So, patient, intervention or exposure, comparison, and outcome. In this slide, I give you some example of clinical question. For example, the question is that, does every treatment with statin decrease cardiovascular mortality compared to placebo in patient with acute MI? Yes, it's a formulated question because in this question or in this scenario, population is defined, intervention is defined, comparison is defined, and outcome is defined. It's necessary to formulating the question because it helps us to search databases better, and after that it helps us to determine the inclusion and exclusion criteria. Because when you search all databases, you find many articles, and after that you should select relevant study to your question, your research question. PICO helps you to find relevant study because it's similar to a checklist, and you can select, for example, relevant study based on this criteria.
Sir, can you explain this intervention and exposure again, sir? Intervention and exposure.
Interventional study like randomized control trial, we have intervention because researcher intervene or introduce intervene. For example, researcher give a group, for example, new drug, and give another drug to another group.
It is like experiment, we can say.
Yes,
It is
yes, it's
experiment.
experiment. Yes, but in observational study, you don't have intervention. You have exposure because it's observational. It's an example about PICO. For example, in adult patient with diabetes type 2 diabetes, does aerobic exercise compared to no exercise lead to improved glycemic control? P here, P is population, or population is adult patient with type 2 diabetes. Intervention or exposure is aerobic exercise. Comparison, no exercise, because you want to compare exercise with exercise and without exercise. Yes?
Sir, can we use PICO on the community-based studies as well? Community level studies?
Yes.
Community level studies?
Yes. Yes. And finally, outcome is improved glycemic control. Okay?
So it's good.
You said service for
3.
well-formulated question. It's very important for your question, for your final exam. Rationale for well-formulated question is it helps to identify and searching for relevant study, and it helps to save time and money because PICO framework help in reducing in time. Please leave your. Okay. So it helps us to, for example, find relevant study, and after that we can set inclusion or we can determine the exclusion and inclusion criteria based on PICO. After formulating review question, we must search all databases, and after that we should select relevant articles. Okay, there are many databases in the databases, and some evidence or some references recommend us to search all databases. For example, Scopus, Web of Science, Medline, Embase, and etc. Okay. So first of all, you should specify keyword for search, and keyword extract based on PICO. After that, you should search databases. There are many databases like Medline, Embase, Scopus, and Web of Science, and some databases are specialized. For example, biological abstract is in field of biology. International IPA is related to pharmacy. PsycInfo is in field of psychology. CINAHL is nursery. Chemical abstract is related to field of chemistry. Agriculture. It's related to agriculture, and EconLight is related to economy. Yes. It's very important. when you talk about all databases, it's very easy. But in practice, it's so hard to search all databases. For example, in Iran, we cannot search all databases because we don't access to all databases like Scopus and Web of Science. But based on evidence, you should search at least 3 databases for having a comprehensive search: Embase, Medline, and Web of Science. These 3 databases are minimum database for conducting a systematic review. Embase, Medline, and Web of Science. Because there is a considerable overlap among databases, it would be better to search all databases, but when you cannot do it, it's better to search 3 databases: Embase, Medline, and Web of Science. It's an example about research method in an article. And the next step is study selection. In next step, you should screen and select a study. And for doing these steps, you should evaluate title and abstract of the articles to determine their relevance to research question. Because some of them is not related to, for example, your topic, your research question. Okay? And this step, please close the door. This step should be done by 2 independent people. 2 independent people. This step in which we should assess the relevancy of this study to our research question should be done by 2 independent researchers, because this work increases the reliability of our work. Yes? And next step is extracting data from a study. In this step, we should create a form or paper form or electronic form for extracting data, and it should be done by 2 independent people. For example, 2 independent people should draw or extract data from selected study, and in this form, it would be better to extract some information, and the most common information that extract from evidence is author, publication year and country or location, study participant or sample size, study design, for example, case control cohort or crossover, it doesn't matter, randomized control trial and etc. Study duration, for example, some study is cohort, and cohort have a follow-up, and it would be better to register or extract the study duration. After that, you should extract measurement of outcome, and sometimes you need another information about this article, for example, confounder and etc. Yes, tomorrow I'll talk about confounder and bias. And in the next step, we should assess the quality of articles, and it would be better to do these steps by 2 independent researchers or independent people, and we should use some standard checklists for assessing quality of the study. For example, sometimes there is some scale, and sometimes we have checklists for assessing quality of articles. For example, Cochrane is an organization that work on systematic reviews, have many tools for quality assessment. For example, risk of bias tools for randomized controlled trial like Cochrane and ROB2, and Robbins is tools for quality assessment in observational study. It's very important for you because when you want to do a systematic review, quality assessment is a mandatory step in systematic review, and you should use some standard tools for assessing quality.
Yes, sir.
And it's, I think, a good scenario for a final question. Robbins, ROB, Cochrane. Okay? It's an important note and point for your finalist.
Sir,
بفارسیش میده؟ جان.
استراحت.
استراحت؟
پانچ دقیقه.
خیلی مساعدگی میخواید برید؟
کم از کم 5 دقیقه.
Bhagat
5 دقیقه. Okay.
Sir, can you write your number here and here?
Purpose of a systematic review is data synthesis. Please close the door, please. Sorry. Is data synthesis. Okay. Depending on the availability and suitability of data, a quantitative synthesis or meta-analysis may be done to combine and analyze the result statistically. Okay. And in meta-analysis is a weighted mean. For example, when you want to calculate the mean score of your semester, you calculate a weighted mean based on, for example, unit of a course. Yes? It's a weighted mean, and in meta-analysis, a study with larger sample size are given more weight. Why? Because the results are more accurate. For example, when you want to pull a lot of study about the prevalence of depression, a study with larger sample size are given more weight, because the study with the large sample size give us a more accurate result. Yes? And in the meta-analysis, we can also visualize the result in a plot. We call it what? Forest plot. What is forest plot? Forest plot is a graphical representation commonly used in a meta-analysis to display the result of individual study and their combined effect estimate. It provides a visual summary of the data and allows for easy comparison and interpretation of study findings. Here is a briefly explanation about, I want to tell you some explanation about the interpretation of forest plot. as you see, this is a forest plot. This is a forest plot. Forest plot is a graphical representation, and it's common approach for showing or for reporting systematic review result or meta-analysis result. As you see, this graph shows some information about our study. For example, one of this information is a study label. A study label. What does it mean? A study label. Each study, it means each study included in meta-analysis is typically represented by a label or identifier, such, for example, such as author name, and these labels help in identifying and referencing a specific, for example, a study. It means, for example, imagine that you want to estimate the relation between healthy diet and diabetes, for example, healthy diet and diabetes. And you, first of all, you have formulated a research question. After that, you search all databases, and finally, you found 2, 4, 5, 6 studies, 6 relevant studies to your research question. It means 6 studies have assessed this question previously or before. Okay?
Is that standard, sir? The level are standard or not? Is that the fixed standard?
No. It's not fixed standard. In this field, I found 6 studies. For example, it may to find more than 6 study in another. For example, another study. Please look at your article, and I think in this article, for example, researcher found 2, 4, 6, 8, 10, 12 articles. So it's not a specific standard. Okay? Okay. This graph, this forest plot, show another information to us. For example, another information is effect estimate or effect measures. Effect measures like odds ratio. Yes? For example, Kelly and her colleagues conduct a study and found that the odds ratio between healthy diet and diabetes is 0.75. Okay?
Yes, sir.
And etc. Okay? And as you see, the position of the marker on the horizontal axis represents a point estimate. It's a point estimate, and this line shows confidence interval. Okay. Do you have a biostatistic course?
No.
No. It's point estimate. We call it point estimate, and we call it confidence interval. Confidence interval. And another information is weight. As I said before, weight is based on sample size. A study with higher sample size gave more weight. Yes? And the size of this square show the higher weight because it's very oversized. And also, this figure show us over effect size or common effect summary. Summary, the overall or pooled effect estimate is usually represented by a diamond marker on the plot. The center of the diamond represents the point estimate and the pooled effect, and the width of the diamond represent confidence interval. Okay, it's confidence interval of pooled estimate, and it's
Point.
point estimate.
So like if Sand and Kelly is an individual or what is population and community? Sand, Kelly, what are these?
These are primary studies.
Studies.
These are primary studies. For example, case control report.
Okay. And I'm asking they are individual या case population या community based. For example, you are saying sand. What is sand?
The name of author in this article. For example, the author name of this article is, for example, Catherine Esposito. It's name of author. First author of this article.
And it means the sand, what is the stability based, is the data?
Yes.
Point
A
estimate.
percentage data?
Yes.
The 0.69.
This relative weight is based on sample size. For example, this article have 2,000 people, and another article has 1,000 people.
It is more weight.
In this situation, big, a smaller the study, or study with a smaller sample size, yes, have a small weight in
Relative.
comparison to a study with a higher sample size, high sample size. Okay.
Point estimate. Confidence interval.
So this is point estimate, this is confidence interval, this is lower limit of confidence interval, it's upper limit of confidence interval, and its effect measure, it's odds ratio, for example. Sometimes you can use relative risk and another measure association. Okay. My presentation is